Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Wednesday, May 12th, 2021. And our top story today, psychological health, well-being, and the mind-heart-body connection. Joining us now to discuss this and a lot more is Dr. Erin Mikos. She's an associate professor of medicine at Johns Hopkins Medicine. Dr. Mikos, Erin, so great to see you. Thanks so much for joining us on the program this morning.
Thanks for having me here today.
Yeah, it's great to talk to you. And we've had your colleague, Dr. Michael Blaha, on the program talking about the importance of heart health. You and some other authors of a recent statement from the American Heart Association really talked about something I think is really important, which is the importance of mental health. And we couldn't see that any more prevalent than through this pandemic. What's the thesis of the statement and the piece that you helped co-author?
Right. So the American Heart Association statement was really trying to emphasize that the mind, heart, body are all really interconnected. And so clinicians like myself, can't consider cardiovascular disease as a single entity, but really need to focus on the whole person, because we know that psychological health, mental well-being can directly impact heart health. And there are both indirect mechanisms through behaviors and direct biological mechanisms, which I'm happy to kind of elucidate, but that's what we talked about in our document.
And look, we've just been through, and we're still going through it. You look at what's happening in India and other parts of the world where the COVID rates are through the roof, but we've gone through a period of isolation, depression for many people, anxiety over what is going to happen, their financial issues. This takes a toll. Short-term stress, long-term stress, Erin, Dr. Mikos, takes a big toll on our bodies, including our cardiovascular system.
Right. So negative psychological health, such as stress, depression, anxiety, anger, can adversely affect cardiovascular health. And so the indirect mechanisms are through behavior. So people under stress sometimes have poor coping mechanisms. They may smoke, they may drink too much, they may overeat or eat poor quality foods. They may exercise less. They might not take their medications or seek regular medical care. So these are sort of the indirect mechanisms. But we also think that stress, psychological stress, can actually have direct effects on the body through biological mechanisms, such as activating the hypothalamus, pituitary adrenal axis. So essentially, this activates the autonomic nervous system, the sympathetic nervous system, the flight or fright response. So people under stress, they're revved up. The activation of the sympathetic nervous system can raise the heart rate, raise the blood pressure. It can release stress hormones like cortisol that can lead to elevations in blood glucose and can trigger an inflammatory cascade. And so these metabolic and hormonal changes can negatively impact the heart and the blood vessels, and potentially even trigger a heart attack or a stroke through rupture of plaque that might be in the arteries. And,
what's interesting, and I think we've seen a lot more willingness to talk about mental health issues, especially in light of this pandemic. Is it I know that you helped co-author this, and you're really bringing this to light, but the stigma that used to be around mental health and hey, just get your stuff in order, right? And I could use different words. Just get your stuff in order, and when you get your stuff in order, let's just get your head on right. That really is kind of passé thinking. As you said, it's all interrelated, and whether you're a younger person, in your 18-year-old to 35-year-old, which I consider to be fairly young, or a more mature person, you've got to get your head in line in a good spot. So the stigma really has gone away.
Well, so the purpose of our guidelines is to really to educate clinicians about this connection and to have clinicians, ask patients about their mental health. I think a lot of doctors don't ask patients because they may not feel equipped about how to manage psychological stress that patients might be under. But really, clinicians can assess this with some simple screening tools, and patients that have more significant psychological distress can be referred to the resources and people that could help them, such as individuals who have expertise in behavioral and psychological counseling. And so it's really important that clinicians ask, because patients may not bring this up, and it's a missed opportunity, because there is data that suggests that if you can improve your psychological health, this may also favorably impact heart health. And I want to mention too that the reverse is true. So both the positive psychological factors have been shown to be associated with favorable heart health, even independent of the absence of negative factors. So having a positive outlook, a sense of gratitude, having a sense of purpose, all of those things, being more optimistic, those individuals are associated for a lower risk of heart attacks and strokes. And we think that's kind of reverse is true, that they may have good habits such as eating better and exercising, having social support. We know that having social isolation is a risk, so having social support. Individuals with more positive psychological factors may seek regular health care and take their medications, but also these healthy coping strategies can help, lower the heart rate and lower the blood pressure, having more attention and focus on well-being. So I think there's a lot that we can do to try to improve our coping strategies with stress.
Are there segments of the population that maybe are more at risk? For example, we've heard about aging in place and some of the challenges for some of our older population, but are there segments that really need to be looked out for?
Yeah, so I think individuals who already have underlying heart disease may be more vulnerable for the risk of stress may have on the heart. As I mentioned, this activation of this flight or fright response can raise blood pressure, raise heart rate. Potentially, if someone already has underlying plaque in their arteries, it could trigger this plaque rupture event. So they're particularly vulnerable. It also seems that women seem to be more vulnerable to the impact of stress than men do. So women are more likely to have a depression and be rehospitalized after a heart attack. And that divorce, that stress seems to be a greater risk for heart attacks in women than in men. And there is a special type of heart disease called a stress cardiomyopathy, where a broken heart syndrome is the other name of this, where a very stressful event, a sudden acute stressful event, can lead to a stunning of the heart function. And this is predominantly seen in women, postmenopausal women. So women seem to be even more at risk than the adverse effects of stress than men do. But certainly older adults are very vulnerable for the impact of social isolation, and older adults tend to have more health problems to begin with, and so the stress can more adversely affect them.
Well, Erin, I want to take a very quick commercial break. When we come back, we'll talk to Dr. Mikos more about psychological health and how it relates to cardiovascular and overall health. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Dr. Aaron Mikos of Johns Hopkins Medicine. Aaron, thanks so much for staying with us this morning.
Yeah, thanks for having me today.
Yeah, this is absolutely an enlightening conversation, and I want to start getting to some of the ways that we can help each other. But let's start with employers, because as I said, there used to be a stigma associated with mental health issues. That seemed to have gone away. I think we've learned a lot through this pandemic, but there's a lot of lost, if your head's not on straight or you're having some issues psychologically, there's lost productivity out there. And so it really behooves the employer to invest in not only benefits like retirement, healthcare, but also maybe mental health benefits, because ultimately that helps improve productivity and actually helps their employees for the longer term.
Yeah, absolutely. So employees should really invest in the cardiovascular health of their employees. And so a lot of this has to do with making the work environment more conducive to promoting cardiovascular health, such as having opportunities to take exercise breaks, walking breaks, maybe access to gyms on site, or at least a walking path on the ground. I think it's, bonuses or incentives for their employees to not smoke and to eat healthy and to exercise, but also to make sure that there's no stigma with employees seeking care for their mental health. But this is really part of their overall physical health because of this mind-heart-body connection. So making sure that they have access to resources, access to counseling, and make sure that this is actually encouraged and not stigmatized to encourage our employees, both mental and physical health.
What can we do as individuals to help each other? Obviously, right now we've got a pandemic, so we're not at 100% full capacity anywhere we go. But say we have a significant other, a mother, a father, a brother, a sister, a child. What can we be doing to engage those people to make sure that we're listening and getting people the help that they need from a mental perspective, or cardiovascularly get them the help they need?
I know people are under so much stress that we may not even realize. And that's why really we need to be kind to everybody. You don't know the battles that other people are facing. So I think we need to look out for each other, check in with your colleagues, with your friends, your families, try to engage them in social connection. Even during the COVID pandemic, when we were, socially isolating from each other, there's ways to be socially connected, even if you're socially distant. And technology has been a wonderful way to connect with individuals through FaceTime or through Zoom and phone calls. So I think we need to look out for each other and encourage. I think there's no stigma, just like any other health issue that you take care of with your blood pressure or your cholesterol, your blood sugar, to address your mental health as part of your overall physical health, and encourage anyone we know that might be struggling. There's a lot of good resources out there, and really want to utilize clinicians and behavioral psychologists. That this doesn't always just mean medical therapy. Certainly some individuals do need medications to help them with their mental health, but usually the most success is in combination with counseling. And for many individuals, just talk therapy, counseling can help a lot of people even without adding a pharmacotherapy. So we really just need to look out for each other and encourage everybody to get the help that they may need, because many of us are struggling, and particularly this past year with the crisis related to COVID.
Yeah, and you bring up a good point. We don't know what everyone is dealing with. I mean, someone could look very happy on the outside, but could be dealing with personal issues. I guess last question here, Aaron. We don't want to forget our routine physicals, our routine checkups, meeting with our clinicians, our doctors, our primary care physicians, right? A lot of us, maybe some of us didn't go to see the doctor because they were closed because of COVID, or maybe they were limiting being in person, but it really is important, or maybe they were doing telehealth, so maybe there was some level of interconnectivity, but it really is important as you age, get that checkup, get your blood pressure checked, all those important vitals around cholesterol, LDL, HDL, triglycerides, you know them better than I do. You don't want to forgo those opportunities to meet your doctor.
Yeah, so everybody needs to have a cardiovascular and mental health checkup. So we want to all know our numbers, because cardiovascular disease is still the leading cause of death in men and women. And we think about 90% of cardiovascular disease is preventable through modification of risk factors and treatment of risk factors. So everybody should know their risk factors and their numbers. But there's a lot you can do as an individual in terms of healthy coping strategies to help both your mental health and your cardiovascular health, such as eating and drinking sensibly, eating a diet rich in fruits, vegetables, whole grains, limiting alcohol, limiting highly processed foods, stop smoking, exercise regularly, 30 minutes a day at least, as well as I think having some time to relax and finding some quiet time, whether it's yoga or meditation or time with friends and family, making sure that you get adequate sleep. There's a lot that we can do. I mean, life is going to have stress. I mean, nobody is free of all stress. And some stress is good. Some stress helps motivate us to meet deadlines, but clearly prolonged stress and severe stress can be pathological. So we all need to find ways to adapt and help improve our resiliency and our well-being.
Yeah, well said. Dr. Erin Michos, pleasure chatting with you. Thanks for the great advice, and we look forward to having you back on the program again very soon.
All right. Thank you very much. Have a great day.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, then drop us a line. And don't forget, for all the information in retirement markets, technology, personal finance, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. We're back again tomorrow, so until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Are you being audited, and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.